You know that feeling. When your heart seems to flutter or race or maybe even skip a beat? Well, today we're going to demystify the condition that's often behind that exact feeling, atrial fibrillation, or as you've probably heard it called, AFib. Now, for millions of people, this isn't some hypothetical question. It's a very real sensation. They'll describe it as a flutter or a racing pulse, or that really weird feeling that your heart just skipped a beat. And you can imagine it can be pretty unsettling, especially because it often just comes out of nowhere. So, what is actually happening inside your body when this goes down? And get this, how can something as simple as the watch on your wrist help doctors figure it all out? Well, we're going to explore all of that, right from the diagnosis all the way to the latest in how you manage it. All right, first things first. What exactly is happening inside your chest during an AFib episode? Now, it's not a problem with the heart muscle itself, which is a common misconception. It's actually an issue with the heart's electrical system, the very thing that tells it when to beat. Okay, so normally the top chambers of your heart, the atria, they give this strong, coordinated squeeze. But with AFib, they just quiver. Seriously, the best way to picture it is like a bowl of Jell-O jiggling around instead of a powerful pump doing its job. And because of that chaotic movement, blood isn't getting pushed through efficiently. That can lead to some really serious complications, with the most notable one being stroke. So, let's say you felt that flutter. What happens next? How do doctors actually confirm that what you're feeling is AFib? Well, the absolute key is catching your heart in the act. Yeah, the entire goal here is to get a recording of that irregular rhythm while it's happening. And the main tool for that is the electrocardiogram, or as you probably know it, an EKG. It's super quick, totally painless, and it gives the doctor a snapshot of your heart's electrical activity at that exact moment. But here's the tricky part, right? That's the real challenge with AFib. It can be super elusive. What if it doesn't happen to show up during that 10-minute EKG at the doctor's office? To solve that problem, doctors need a much longer look. They need a way to monitor your heart over days or weeks, or sometimes even longer. And this is where the diagnostic toolkit gets really interesting. For a super detailed 24-hour look, a doctor might hook you up with a Holter monitor. Now, if your symptoms only pop up every now and then, there's something called an event recorder that you can wear for weeks. And for those really rare but serious episodes, there's even a tiny device they can implant right under your skin to keep watch for up to 3 years. Each one of these tools is basically designed to solve that exact problem, catching that sneaky, elusive arrhythmia. But what if you could have a heart monitor with you, all the time? What if you could flip the script from reacting to symptoms to proactively watching for them? Well, that's exactly where something a lot of us already have on our wrists comes into play: wearable technology. And listen, we're not just talking about your basic fitness tracker here. No way. These are certified medical-grade devices that give you a continuous beat-by-beat watch on your heart. They can actually vibrate to alert you if something's irregular, and you can even take a medical-grade ECG right there on the spot. And the best part? It can send that data straight to your doctor. Let's talk about a real-world example, because this is where it gets really powerful. There was a 67-year-old woman who had a stroke, and her doctors suspected AFib was the hidden cause. But to prove it, they needed to monitor her long-term. And, she really wanted to avoid another medical procedure, so she opted for a medical watch instead. So they tried a standard 24-hour monitor first, and it found nothing. But just 3 months after she started wearing the watch, it detected the hidden aphid. I mean, think about that. This discovery was absolutely crucial. It meant her doctors could immediately get her on medication to prevent blood clots and hopefully help her avoid another stroke. Okay, so once AFib is officially diagnosed, the focus shifts immediately. Now it's all about creating a solid plan to manage the condition, get the symptoms under control, and lower those risks. The whole treatment strategy is really built around these 3 main goals. Goal number 1, and this is the big one, preventing blood clots, to bring down that risk of stroke. Goal 2 is controlling how fast the heart is beating, to reduce the strain on it. And goal 3, whenever possible, is to actually reset the heart's rhythm back to normal. So how do they achieve those goals? Well, your care team will talk you through a path forward that usually involves one or maybe a combination of these 3 things: medications to control the heart rate and prevent clots, special therapies designed to reset the rhythm, and for more persistent cases, there are more advanced procedures. Now, when the heart's rhythm needs a hard reset, a therapy called cardioversion is often the answer. And this can be done in 2 ways. There's electrical cardioversion, which uses controlled shocks, yeah, kind of like what you see in the movies, to jolt the heart back into a normal rhythm. The other option is drug cardioversion, which uses specific medications to, well, chemically coax the heart back into sync. But look, medical treatments are absolutely essential, but they're really only half the story. The choices you make every single day can have a massive impact on managing AFib and just living well with the condition. These recommendations from the Mayo Clinic are basically a set of powerful tools that are totally within your control. Every single one of these, eating a heart-healthy diet, getting regular physical activity, managing stress, getting good sleep, all of it directly supports your heart health. And it can make a huge difference in how you feel and even how often AFib episodes happen. So when you boil it all down, the key takeaway is this. A diagnosis of AFib is not some kind of endpoint. Not at all. It's the beginning of a proactive partnership. It's about you, your doctor, and the best available technology all working together to manage your health so you can live a full life. And that really leaves us with a fascinating thought, doesn't it? As technology gives us the power to monitor our own vital signs with medical-grade accuracy right on our wrists, well, we're becoming more active participants in our own healthcare than ever before. It really makes you wonder, what comes next?